Let's talk about infarction. It is defined as an area of ischemic necrosis caused by occlusion of vascular supply to the affected tissue. Types of infarction based on color or based on presence of microbial infection. Based on color, red, hemorrhagic infarcts, and white, anemic infarcts. In red hemorrhagic infarcts, there would be venous occlusion, for example in ovary, and in white anemic infarct, there would be solid organ, that is heart, spleen, or kidney would be involved. On the basis of presence of microbial infection, we say that if this microbial infection is present, it is called a septic infarct, while as if it is not present any microbial infection, it is called as blind infarct. Infarcts are wedge shaped with occluded vessel at apex and periphery at the base. This is an important point. Let's talk about infection sequence, like how it develops. First of all, ischemic coagulative necrosis occur. Then after that, there is inflammatory response at margins that occurs within the few hours. After that, over there will be repair response, and at the end, infection will end in the form of the scar tissue. This is not the case with the brain, because brain show liquefactic necrosis. So if there is any hypoxemia or tissue vulnerability to ischemia, then brain would be definitely damaged. Let's talk about the factors that cause involved in infection. First is the anatomy of vascular supply. Those organs that are having the dual supply do not show the infarction. For example, dual supply of lungs, that is by pulmonary and bronchial arteries. So means that if there would be any obstruction of pulmonary arteries, that does not cause lung infarction unless and until bronchial circulation is also compromised. Similarly, liver receives both circulation from hepatic artery and portal vein, and hand, forearm with its parallel supply like radial and ulnar artery, so they are resistant to infarction. Second point is rate of occlusion. In slowly developing occlusions, they are less likely to cause infarction because they allow time for the development of collateral blood supply. For example, if one coronary artery is slowly occluded, for example by encroaching atherosclerotic block, flow in the collateral circulation may increase the sufficiency to prevent the infarction. Third case is tissue vulnerability to ischemia. For example, neurons undergo irreversible damage within 3 to 4 minutes, while as if myocardial cells are harder. For example, they take 20 to 30 minutes to develop ischemia, and it's difficult to develop ischemia within fibroblast. In hypoxemia, for example, low blood oxygen content will increase both the likelihood and extent of infarction. That's all.